Welcome, everyone. My name is Deepa Iyer. I'm a senior advisor at the Building Movement Project. I'm also the director of Solidarity Is. I want to thank you for joining our webinar this afternoon, which is focused on better understanding the challenges and opportunities facing communities of color during this global emergency. We're really grateful again to have so many of you join us. We have a lot to cover, so we're going to get started. The webinar will last for about an hour and 15 minutes or so. So on the next slide, we're going to see some information about the technology that I think we're all getting used to. Your video, if you are a participant, is off. We cannot see you. You will, of course, be able to see our speakers. If you have any questions at all for the speakers or on any tech issues, please use the Q&A interface. This is different from the chat. And so you'll use that Q&A interface to ask questions, and we will take care of those. We'll also have time for Q&A in the middle of the webinar, so feel free to pose questions as they come up. I also know that all of us agree to being respectful and civil in our comments and our questions. Given that there's so many folks joining us today, we can't do proper introductions, but we do want to put up a quick poll for you to take to get a sense of who's here and from where. Captain Foley, my colleague at Building Movement Project, is putting up a poll on your screen now to take. It asks you where you're from, where you're based, and what sector you work in. So we're going to take a minute or so to take that poll. As you do that, I want to remind you that our webinar is being recorded today and that we'll share it along with a transcript as well as other resources. In addition, if you're someone who can live tweet while you are on this webinar, and maybe some of you can do that, we encourage you to do so. You can do so by using the hashtag COVID in our communities. So we're going to end the poll in just a couple of seconds. So for those of you who are coming on board, again, welcome, and go ahead if you can and take the poll so we know where you're based and what sector you work in. All right, so as we end this poll, we're going to go ahead and end it now and see that we've got people actually working or based in a lot of different parts of the country, a lot of folks from the East Coast, of course, primarily, and the Midwest. We also see that in terms of the sector that folks work in, we've got a lot of folks who are social service providers, others who are in movement building organizations, as well as folks who are connected to philanthropy, government, and university. So a real cross sector of folks who are here on our webinar today. So again, the hashtag is COVID in our communities if you can live tweet along. Moving on to the next slide. I want to, again, remind you as we get to the next slide that if you have questions, please use the Q&A interface to ask your questions, and we'll try to respond to them as soon as we can. So I want to tell you a little bit in terms of Building Movement Project and Solidarity Is. Why are we hosting this webinar? It's because we believe strongly in centering and uplifting voices and experiences of communities of color who are often not part of the narratives that emerge in moments of crisis. For 20 years, Building Movement Project, or BMP, has strengthened the nonprofit sector with tools, trainings, and resources around leadership, service and social change, and movement building. You can see some of these resources on the slide here. Solidarity Is, which is a project that I direct, is hosted at BMP as well. Through a podcast, Solidarity Schools, and resources such as mapping our roles in a social change ecosystem, Solidarity Is helps individuals and organizations deepen our solidarity practices across movements and communities. So given our work and our values, it was natural for us to engage in this conversation in terms of COVID by focusing on the effects of this time on communities of color and, of course, the organizations that work closely with them. So moving on to the next slide, and I'll stop talking very soon so we hear from the panelists. We just wanted to tell you a little bit about the goals of our webinar today. But before we get into that content, I just want to take a moment to recognize that this time is a painful and disorienting and uncertain one for all of us. Each of us is coping with a unique set of circumstances, challenging circumstances, professional, personal, in our communities, our families. Whatever your situation is, We hope that you feel supported here and outside of this space. And for people of color, undocumented people, queer and trans community members who are joining us, we hope that this session provides comfort, solidarity, and resilience. At the same time, we acknowledge that we who are joining this webinar have a tremendous amount of privilege in convening and participating in sessions like these, and that each of us has a role to play in terms of learning what we hear and making change in our broader social change ecosystems. So with that, we're hoping to reach some of these goals on our conversation today, to shine a spotlight on how this crisis is affecting Black, Indigenous, Latinx, and Asian communities, to understand how organizations serving and organizing in these communities are pivoting in this moment and what's required from government policymakers and philanthropy. And then lastly, to try and imagine what a post-COVID-19 society would look like. So moving on, all of us know that this pandemic has just revealed and unmasked, you'll see that in the next slide, what advocates have been saying for decades, that there are racial and economic disparities in this country that disadvantage Black, Indigenous, Latinx, and Asian communities. We also know that the pandemic is not the cause of these disparities. They're the result of historic, multi-generational patterns and policies that have largely been ignored, denied, or papered over by government, policymakers, and institutions with power. And these disparities get only heightened when you add additional layers. For example, people of color who are also queer or trans, or have a disability, or are working class, or are limited English proficient, or undocumented, face even a deeper set of challenges and barriers. On this slide, you can see some of the increased risks that different communities are facing, from access to care, to gender-based violence, to high rates of unemployment, to out-and-out racism. We know some of the stats already, that in places like Louisiana and Michigan, Black people are disproportionately comprising the numbers of deaths from this disease. We know that in terms of unemployment rates, that Latinos are reporting that they had a pay cut or lost a job due to COVID-19 more than other US adults. We know that rates of anti-Asian racism are on the rise, and that Native Americans are facing an uptick of cases and lack of access to care. These statistics, while surprising for many in this country, are not surprising for people like our speakers, who every day work with Black, Indigenous, Asian, and Latinx communities. So I want to turn to our speakers and welcome them now. And on the next slide, you'll see information about our speakers. So I'm so pleased to welcome them into our conversation. Today, you will hear from Linda Campbell, who's the director of the Detroit People's Platform, Arthi Kohli, who's the executive director at Advancing Justice Asian Law Caucus, Judith LeBlanc, who is the director of the Native Organizers Alliance, and Claudia Medina, who is the executive director of Enlace Comunitario. Each of these individuals are also working in different parts of the country, so we'll hear a little bit about what is happening in their communities as well. So as we move to the first question, and we've got 3 questions that I'll be posing to each of our panelists. The first question, and we'll look at that slide, is what we talked about already, that COVID-19 is having a disproportionate impact on already vulnerable communities that are dealing with structural racism. So how is COVID-19 only exacerbating these disparities? So as we go ahead and turn to our speakers, I'm going to ask Judith LeBlanc from the Native Organizers Alliance to go first, followed by Arthi Kohli at the Asian Law Caucus, Claudia, and then Linda. So go ahead, Judith.
Thank you so much, Deepa, for organizing this exchange. I am a member of the Caddo tribe of Oklahoma, and I have a Boston accent, which is a really good source of humor all over Indian country. So how is COVID-19 affecting our communities? Well, on one side, we have the amazing, resilient reaction of organizing a virtual powwows online, where people, though sheltering in place, are conducting dances and sharing cultural music, dancing, and prayers, and highlighting individual frontline healthcare workers and what they're doing and what they're experiencing. We're also seeing, I just heard today how in Washington State, there's unusually warm weather. And so some of the tribes there are actually able to do harvesting of razor clams and fishing. In Wisconsin, one of the groups we work with there, they're doing sapping, collecting sap, and it's a beautiful thing. But the pandemic has revealed the failure of the federal government to recognize our sovereign treaty rights. And of course, treaties were what was signed with Indian tribes in exchange for the land grabs, for giving up our land here on Turtle Island. And the pandemic has revealed how vulnerable we are in the economic arena. The chronic underfunding of housing means that 2 to 3 generations of families live in one house. The chronic under-resourcing of healthcare facilities. In mid-March, there were only 100 ventilators in the Indian health system in mid-March. But it also is, we are vulnerable culturally. In 2 pueblos in New Mexico, there is the highest infection rate in the US. What does that mean? That our elders, our vulnerable peoples who are our culture and language carriers are very much at risk. And in Indian country, we have very high cardiovascular disease, diabetes, and cancer. But I must say, one of the things that has struck and really shook up everyone is the lack of racial data collection in the course of this pandemic. And when some of the numbers were revealed on Black and Latino communities, I live in New York City, it sent a shockwave. It revealed to many what structural and systemic racism is all about. For Indian country, we are always considered statistically insignificant. That 2 million people are statistically insignificant. So we have very few data collections, but in the Indian Health Service, we show that there have been over 1,000 deaths. In Arizona, which is with the Navajo Reservation, covers 4 different states in the Four Corner region, 16% of all those who've died in Arizona are native. So I think one of the big things that it continues to reveal is that there's a racist data gap, that there isn't enough data to understand where the resources need to go in order to address not only the crisis that's unfolding with the pandemic, but the chronic underfunding of the healthcare system.
Thank you so much, Judith, and thanks for reminding us also about the underlying invisibility of Native communities, which has just gotten exacerbated. And we'll hear a little bit more about how Judith's organization and others are responding to that crisis in a minute. But I want to move to Arti Kohli, who's with the Asian Law Caucus in San Francisco, to share a little bit about how Asian American communities are experiencing the crisis. Arti?
Okay, thank you, Lisa. I just want to also say the first place I lived in America was in Jackson Heights, New York, and my heart is going out to that community, including to the communities we serve in the San Francisco Bay Area. But I just feel like what Deepa said, I can't be emphasized enough. All the inequities have come to the fore. They've always been there, and now we're seeing how current systems are failing our people. So San Francisco is one of the wealthiest cities in the country and has some of the poorest populations. And our clients are low income Asians and Pacific Islanders. Many don't speak English. They're restaurant workers, they're transportation workers, they're caregivers. They're elderly folks. And so obviously the first impact that we saw was economic. Our office is at the edge of Chinatown in San Francisco, and it was a ghost town immediately. And a lot of the low wage workers were losing their jobs. and we had elderly people who lived in single room occupancy motel type situations. And there was no way for them to shelter in place alone. They were and I'll continue to be in contact with many of the people that they're sharing bathrooms and kitchens with. Mm-hmm. So that was the first impact that we saw. And later on, I'll share how we're addressing some of these issues. The second piece so was workers and housing. That was kind of the immediate piece. And then we immediately also started thinking about all our clients. We have a lot of Southeast Asian clients in immigration detention. ICE has been trying to deport these folks for some period of time now. And a lot of them have underlying conditions, asthma, heart disease. Some of them are cancer survivors. And so we were extremely worried about folks in ICE facilities. As it is, those facilities are known for having really poor health care, really poor conditions. And now, if you're more vulnerable, it could be a death sentence. So that was the second group of clients that we were, thinking about. And last, but certainly not least, for Asian Americans, if you at all read the news or being engaged, the hate that's coming at especially our East Asian community members, anybody perceived to be Chinese. With the president's rhetoric, which is like his usual way of blaming, calling it the China virus, all these things, was just an invitation for white supremacists and then other people who are, ignorant, to both intimidate, bully, harm. I mean, there's been a range of different levels of violence, verbal intimidation. People going to the grocery store is a scary endeavor for many of our community members. It's not just scary because they're worried about getting the virus, they're worried about getting harmed. They're worried about someone, in New York, a woman was putting out her trash and she had acid put on her. Just a few days ago, 4 Chinese restaurants within 4 blocks of San Francisco were vandalized and burglarized. So, the hate is coming out in many different ways. Bullying at school or within, you would think that with sheltering in place, that it's somehow less, people are less able to do it, but you'd be surprised at what is coming out. And so I'm South Asian. I remember what happened post 9/11. The impacts on Arab, Middle Eastern, Muslim, South Asian communities and the targeting was significant. And there was also severe, and I think many of us in the community are very afraid of an incident like Oak Creek, where a Sikh Gurdwara was, where there were people shot, and killed by someone targeting what they thought were Muslims. And so we're trying to learn from our history, which we know this scapegoating is going to continue and intensify, and we have to be ready for that. And what has followed, from the hate violence is not only from individuals, but from the state. So it's led to surveillance. We've seen targeting of Chinese scientists as spies, so there's all kinds of things that are going to be coming out, but this is the immediate piece that I'm seeing.
Thank you so much, Arti, and thank you for reminding us about this aspect of place-based violence and discrimination, the homeless, Chinatown detention centers, and of course about the ongoing racism that Asian Americans are facing. So we'll move on to Claudia Medina, who is going to tell us a little bit about the communities that she works with, Latino, undocumented communities and women in Albuquerque. So Claudia?
Good morning, everyone. Well, good morning, no, good afternoon. Buenas tardes a todos. So I work at an agency called Enlace Comunitario, who serves mostly immigrant women victims of domestic violence. Most of them, I would say 95% of them, are unauthorized to work in this country. And they have been, for years, most of them working under the table, meaning they work on the service sector in jobs that are the ones being more affected by the COVID-19. The majority of them have lost their jobs, and they are particularly affected because, one, they don't know the language, and so it has been very hard for them to understand what is COVID-19, what are the resources available to them, where to get a free test. Is such a thing as a free test. Most of them do not have health insurance. They don't qualify for Medicaid, even though they are very, very low income. Due to their immigration status, they are also afraid of seeking services for fear that the public charge issue is gonna affect their possibility of getting their immigration situation fixed in the future. So they, on top of all the things that are related to the economic insecurity, they, of course, don't qualify for unemployment or for the stimulus monies that were approved by Congress through the CARE Act. And so they are in a more difficult situation to keep their family fed. And if this was not enough, they are victims of domestic violence. And during this particular pandemic, it has been clear that many of the abusive partners that live with our clients, with the victims, have also lost their jobs. So they are having to live with the abusive partner 24/7 in the same household, with an additional layer of stress. The economic insecurity is such a huge stressor for our families that the domestic violence situation becomes more volatile. And so there have been reports of more and more incidents of domestic violence, and the women feel very unsafe to make a police report, to call us seeking for assistance. So that has compounded all the additional, all the stressors that most families are facing due to COVID-19. The domestic violence and the immigration status have made the situation untenable to the people we work with.
Thank you so much. Thank you so much, Claudia. I really appreciate you laying that out and also talking about the layers around not just the economic insecurity, but limited English proficiency, and of course, the gender violence and abuse that you all are seeing with communities. Thank you for your work. Last but not least, I want to turn it over to Linda Campbell, who's with the Detroit People's Platform in Detroit, Michigan, who's going to talk a little bit about the types of issues that they're seeing in their communities there. Linda?
Oh, good afternoon. Thank you, Deepa, again for organizing the webinar. And I want to acknowledge my panelists. Many of I've never met before, but I feel like we have a common bond. We are women of color. We are women of color on the front lines of this horrific public health crisis. And so we're here today to share out to those of you who've joined the webinar, but to also stand in solidarity with each other. So I just wanted to lift that up. I am a member of the Detroit People's Platform, and the Detroit People's Platform is an organization based in the city of Detroit, but we're also a sister organization and very much rooted in the Building Movement Project. I was one of the founders of the Building Movement Project, along with my colleague Francis Conrader, about 20 years ago, when we set out to work with nonprofits and ensure that nonprofits would develop a more equitable and progressive perspective to their work. So we've been working with nonprofits trying to build capacity and lay the path to enable communities, particularly those of us who work with communities on the ground, to meet such a challenge as what we're confronted with today. So Detroit, as many of you know, is the largest Black majority city in the country. And quite recently, there's been a lot of press about the disparate impact of the coronavirus on Black Americans. That is very much evident in the city of Detroit at this time. Right now, Michigan, the state of Michigan, I believe as of this morning was number 4 in terms of number of cases. And the city of Detroit, even though we only represent 10% of the state of Michigan, we account for 26% of positive cases and 25% of the deaths. So we are definitely the epicenter of the COVID epidemic here in the city of in the state of Michigan. And many of you are familiar with the historical and social and health disparities that are part of our communities as women of color, but also have been rooted in our existence here as Black Americans. We suffer from disproportionate rates of high blood pressure, diabetes, asthma, all of those, obesity, all of those pre-existing conditions make us more susceptible to the impacts of the virus. And so in that regard, we're very much aligned with our sister cities across the state of Michigan, who are also seeing among their Black community disproportionate numbers in terms of infections and death, and very much aligned with our other Black communities across the nation. I think Deepa mentioned earlier New Orleans and city of Chicago. So I would lift up a couple of conditions that I think exacerbate the virus and its impact here in Detroit right now. And one of the things I want to say is that a lot of what we're seeing here in Detroit, in addition to that which is related to the health and existing conditions that our people have, is also rooted in a sort of a strategy around economic development and comeback that many of you have heard over the past several years, that Detroit felt like Detroit had rounded the corner and was finally emerging from emergency management and bankruptcy. If you recall, we went into bankruptcy, the largest bankruptcy in the history of the country, which impacted us in a variety of ways. Reduced level of services to Detroit, to residents, and really put us under a pretty austere fiscal policy. And that resulted in policies that we believe have have had impact on our preparedness to deal with the virus. And one of those policies were the mass water shutoffs that came about because of a need to make sure that the city was able to collect on the debt of low-income and others here in the city of Detroit. Well, as we all know, that one of the primary prevention strategies for addressing the virus is hand washing. It took a lot of hard work on the part of advocates to convince local authorities that there was a need to revisit that policy and restore water to citizens here in Detroit, who, as late as February, many were living without access to water. Because of the—
Linda, if you could wrap up in about 15 seconds or so.
Okay, sure. Just to say that some of our investments that we've made in terms of economic development have resulted in what we believe is overinvestment in leisure and hospitality, and therefore a number of our families and residents are in those public-facing situations where they're more likely to be impacted by the virus. Many of them continue to serve as essential workers. And I think, as one of the panelists mentioned earlier, because of the incredible cost of housing in Detroit, we've got mixed housing where generations live together. There may be only one person working. And so therefore, even in the mitigation, social distancing, staying safe at home, we find that there are underlying issues that exacerbate race.
Thank you so much, Linda, and thanks for really driving that home, that the underlying structural issues are leading to a crisis that's much bigger for Black, Indigenous, Latinx, and Asian communities. So now that we've got that kind of framework in mind, I want to shift to our second question, which we'll put up on the screen really quickly, which is around how organizations are shifting their work, how communities are shifting in the wake of this crisis, and what we need from government, philanthropy, and policymakers. And as we put this up, we're going to try and put up a poll that also asks this question of the audience, which is about what it is that you all are seeing in terms of your work shifting. So we'll try and do that as we move into the discussion portion here. And so you'll see that poll come up. If you can take a vote about how your organization's been affected, that would be helpful for us. So I'm going to actually start this question again. We'll start with Claudia, Arthi, Linda, and Judith. That's the order we'll go in. And again, we're really thankful to everyone who's joined. Please feel free to use the Q&A because we are going to take some questions from the audience soon. And we also encourage you to go ahead and tweet. You can screenshot us with hashtag COVID in our communities. So we're going to, I think, Catherine, let's go ahead and end the poll. I think we've had more than 60% voting, and we'll share the results. So it looks like almost 87% have adjusted or changed their strategies and programs. And that is the biggest piece. And I assume that all of the panelists who are working at their organizations have done the same. So we're going to get a sense of what you've done in terms of the work that you're doing. How are you pivoting to shift your work in the wake of this crisis? And what do you require? What do you need from government, and which is making response efforts, philanthropy, which is setting up rapid response emergency funds, and policymakers? What do you need from them? So Claudia, we'll turn to you first, and then Arthi, you'll be on deck.
Yeah, so we have to make significant changes in the way we operate Enlace Comunitario. My first responsibility is with my team. We have a wonderful, wonderful team of close to 30 people that work day in and day out to provide services to the victims, but we didn't want them to be infected with the virus. So we have to close our center physically, but we have to continue providing services from afar. To do that, since we have to keep a very strong confidentiality protections to the data and the conversations with the clients, we at the beginning have to do we had to do a lot of accommodation to get all our services electronically, but protected through a very strong firewall. And this is through web-based services that are HIPAA protected. So at the beginning was a lot of logistical things to make sure that people could use their own cell phones, but the cell phones were not tracked, lots of little logistical details. After that, what we started doing was contacting one-on-one every one of our clients and making sure that they understood what resources were available to them, what COVID-19 was, the additional services that we were provided, making sure that they knew that we were still open and that we were completely available to them, but through different technology. Many of the immigrant members of our community are very comfortable using WhatsApp, but they are not comfortable using Zoom or FaceTime. Many of them don't have sophisticated iPhones. So we had to start connecting with them via FaceTime. Our website, FaceTime, Instagram were constantly updated to make sure that our clients knew where to go for free food, where to get free testing, etc.
Mm-hmm.
In addition of that, we were very concerned with the safety of our clients. So we started providing information about safety planning when you are living with the abusive partner in the same place, making sure that they knew that they can call us at many different times when the abusive partner wasn't around. In addition to the safety planning, we were in need of offering more counseling and more flexible opportunities for them to do counseling. We also have to move some of our support groups also through the web, and the same with parenting classes, with life skills classes. So we have to pivot that way to make sure that our clients had that additional information. But the most important thing that we did is raise funding and reallocate funding in a way that allows us to provide cash to our clients. We have many families that didn't have any money to buy medicine, to buy food, and so we have been providing $500 cash in a gift card to our clients when we get donations. And we have also done rental assistance, et cetera, et cetera.
Thank you. Thank you. I think you laid out those layers really well in terms of both staff who are affected, as well as obviously the most affected community members that you work with. And I'd love to hear, as we turn to Arti and Linda and Judith, I'm sure all of your organizations are making some of those changes in terms of your staffing. What other ways are you pivoting? And what do you require from philanthropy, government, and policymakers? Arti?
Yeah, so similarly, we had to shift our staff to remote work. We were very lucky that we had invested in our infrastructure. So we had remote desktop access. We have access to all our files with confidentiality, with security, which was very important given the work that we do. So we were up and running like within a day or two. We basically switched our phone lines and we started, telling all our community partners that we were available. And what we ended up doing is creating, especially for the workers, in language videos to help them understand their rights under California law. And then we've been doing a ton of train the trainers, where a lot of our community partners, because we're a community lawyering organization, so we work in hand with a lot of organizing groups, membership groups, and so, you know, training them on even applying for, you know, unemployment insurance, even for those of us who have degrees is difficult. So much less somebody, you know, who is not an English speaker. So that, and then we also staffing clinics with our partners. So that was sort of the immediate work, immediately starting to do advocacy with the courts for our, you know, filing for petitions for our detained clients. But what's become apparent even in this short time frame is what we need more of is coordination. And so we have multiple undocu funds. I mean, we're fortunate in California that there's multiple funds, but and potentially the state is going to weigh in here too. But where is the coordination for this? Also, we could tell that our state agencies were overburdened. You know, the language lines, the wait times were incredible. No one was answering the phone. All this, you know, so there was two infrastructures that were, you know, the nonprofit infrastructure and you have the government infrastructure, all of which are strained. And one of the things that's really important is communication. So communication on the front end from those of us who are providing the services, seeing the issues that are coming up for our communities, and receptivity from the government agencies who are also trying to pivot and absorb, you know, all the applications for services and benefits. And you could see where the lack of investment in both infrastructures was really kind of showing up, right? Because if you're an organization that doesn't have the ability to pivot, it's taking you much longer to serve people. If you're a government agency that's not equipped to, you know, take applications or have a lot of rules in place, sometimes unnecessary rules, you know, you're going to have to shift. And that's actually part of what we're seeing is like some of the extra paperwork, extra stuff. If the agencies can get rid of it now, why couldn't they have done it before? You know, that's one of the questions that we're asking. And I think for philanthropy, it is that issue of like, you know, rapid response is great. And I see, you know, the rapid response for the cash benefits for people who aren't eligible for federal benefits. I see that need and I absolutely believe it. But without the long-term investment in our communities, in our organizations, and in building up a government infrastructure that works for our communities, you know, this will continue. And so that's kind of like the issue. And I think if you look at the way, you know, I appreciate the short-term support, but I'm really concerned about the long-term. That is where I worry not only about my organization's health and future, but about my community's health and future, right? So we are, I think everyone is recognizing we are essential. We are essential now, you know, our work is, and so that investment should be thought about in a more concerted way. The last thing I'll say is API communities get 4% of philanthropic dollars. We're like more than 27%. We're the fastest growing part of the immigrant communities. So, and we're also perceived as model minorities, but I can tell you there's huge need. And so I think some of that invisibility, which is shared by my colleagues here, needs to be brought up.
No, thank you, Arti, and thank you for bringing those two words that I kept hearing when you spoke. One is the coordination and lack of infrastructure that's uncoordinated, and the second is long-term investment in our communities, not just the rapid. Philanthropy has to stay on the scene long after the crisis is abated, if it is at all, right? So thank you for that. So I want to move on to Linda now in terms of hearing about beyond the staffing needs and some of the program needs, what other ways have you switched your strategies, Linda, and what is needed from government? You began to talk about government a bit in the last time too, now and in the future.
Well, of course, in order to be in compliance with the emergency order here in the state of Michigan, the staff, we're all working from home, we're working remotely. And as you identified earlier, that's a very privileged place to be. For us, that's a decided change because about 90% of the work that we do, Detroit People's Platform, we do that work in community, face-to-face, meeting with people in their neighborhoods, in church basements, in community centers. And so this is a major disruption in the way that we do our work. We've spent all that time building trust relationships because we show up in community. The work of Detroit People's Platform actually grew out of our initial partnerships about 14 years ago with social service agencies. So what we've been able to do successfully in light of the pandemic is to strengthen the role of our social service partners by giving them extra support. So for example, supporting them with immediate fundraising activities, also redirecting a little bit of our funding to them to help support purchase for water and food and masks for volunteers as well as essential workers. And we've also been very active with our local social justice fund in helping to push out a rapid response grant to get monies to folks on the ground, because it's a huge need, everyday need, as folks continue to lose their jobs. The unemployment benefits are slow in coming because there's such a demand. So we're thankful to have had those relationships that allowed us to be there and to be ready to support. I would say in terms of what we need from government, we're very concerned about transparency right now. Because we understand that even though we're in the midst of this pandemic, there are lots of decisions that are being made about what post-COVID Detroit will look like. And so we are asking that our city government particularly utilize all the tools that they have at their disposal to make sure that governance is transparent and remains as open as it can to residents. That means complying with all of the open meeting laws as best they can, and also taking advantage of the existing and varied forms of communications so that they can receive feedback around accountability in their decision making. We want to make sure that Detroiters have a role in how the CARES funding will be allocated in the city. We hope that we can use CARES funding to address some of the structural and systemic issues that have occurred over the past several years with the way we've invested large tax public investment in private development. We want to shift that to make sure that the CARES money is used to sort of rebuild the social infrastructure in our neighborhoods. And then we also want to make sure that philanthropy understands that those folks on the front line who are doing this heavy work don't always show up like the large, professionally led nonprofit organizations. We want to encourage philanthropy to make more investments in those frontline organizations, many of them led by women of color. And we want them to streamline the requirements that allow these groups to get access to funding and help provide that neighborhood social infrastructure that's there, not only in times of crisis, but throughout as part of the everyday infrastructure and support in these neighborhoods.
Thank you so much, Linda. That was really, really helpful, not just I think for Detroit, but for all of us listening who are living in different parts of the country. So thank you for that. And I want to now turn it over to Judith to tell us a little bit from your perspective at the Native Organizers Alliance. How is organizing shifting, and how are you? What do you all require, right? What do Native communities require, and the organizations require from government or philanthropy? All yours.
So the Native Organizers Alliance was founded out of the grassroots mobilization in Indian country for the passage of Obamacare. So solidarity and working together with others is a part of our DNA. We're an organizing and a training network, so immediately we've begun to redesign our trainings. It's both Native community organizing based on traditional practices of community building, as well as leadership development based on traditional ways of nurturing and mentoring leadership. We've begun to redesign those trainings to go online, but we've also made some big shifts in conversation and in collaboration to make some big shifts on campaigns, in particular the 2020 elections. In the 2020 elections, there are 7 states where the Indian vote is the swing vote that will determine the fate of 77 presidential electoral votes, as well as some key Senate and congressional races. And so we want to create a way for the grassroots to mobilize for the policies that are needed to defend democracy, because that's what we're talking about. Because under cover of this pandemic, it has always been the case that the right wing wants to push its longer term platform. So what we're doing at the grassroots is this: we're about to initiate a campaign to raise resources and money to ensure that there are clusters of leadership on reservation and urban areas who have access to Wi-Fi and broadband by paying for extra data on their phones or to get that Wi-Fi added to their cable, and to hopefully get Chromebooks for these clusters of leaders. Chromebooks as a way of getting online and helping tribal leaderships to begin to function on a leadership decision-making basis online. I know one tribe in South Dakota, one group we work with, convinced their tribal leadership to meet on Zoom and therefore allow for members of the community to meet with the tribal leadership via Zoom. We also see it as a leadership development, because the trainings that we'll do, but also the participation in discussing political developments as they are happening moment to moment, is a critical feature to leadership development. And lastly, we really think that campaigns that move towards systemic change are necessary. So we're about to launch a campaign around broadband access to tribal communities. The digital divide is great, but the truth is that at a time of crisis, we know that given the needs for telemedicine, given the needs for communication and understanding the nature of the impact of this crisis, both the economic and the social and the health crisis, is critical for the survival of families and our elders, and also for our culture. Traditional teachings have always shown our peoples that science and culture move on parallel paths, but at times they intersect. And in a time when science does not know what it doesn't know, when there are unanswered scientific questions as it is with coronavirus, then it's our spirituality and our culture and our values that will carry us forward. So we're even hearing now of some of the groups that we're working with who are convening song circles where they're able to sing and lift each other up in tribal communities. We're hearing about beading communities that are sharing traditional beading. We're going to sponsor a series of ribbon skirt tutorials online so that people can feel that they're, as they say, alone together. But the truth is that our values and our spirituality are being interrupted by this pandemic, and so is solidarity. So we believe that launching a campaign, hopefully in alliance with those, to guarantee broadband access for elders, for those who are at the most risk, and across communities, urban, rural, and reservation, would be a significant step forward. So we're hoping to launch that campaign in the next couple of weeks.
Thank you, Judith. And thank you so much for bringing us back to culture and values, history, ancestors. I think that's really important, that in a conversation that's about communities of color, that we actually center that. So thank you.
And in order to do that, I had to take off my earrings because I heard that they were clanging, because I'm so, adamant about
Thanks for making
a cultural
Thank
sacrifice.
you for making that compromise. Yes, a cultural compromise. We appreciate it. So some of the concepts that I kept hearing over and over again with philanthropy in particular is concepts like digital equity. right? Also frontline organizations and systemic change and political education. There was even a question around how political does philanthropy need to get? And I think the answer is clear. Who are the frontline organizations to support these and their partners? That was another question that came up. So we're gonna move into the Q&A portion, and I wanna let folks know we still have like a good number of folks, over 500 on the webinar. Thank you for staying with us. We might go over about 5 minutes, but we're going to get there because we have one more question after this, which is really about what does a post-COVID-19 society look like? So I actually want to ask, there were a lot of questions that came in through the Q&A portion. We appreciate them. We can't get to all of them. We will, however, take these questions and we'll put them together in a way that we can answer them in another fashion later on with the follow-up materials. We also really appreciate folks for writing in and just, I think, plus oneing and reinforcing what folks are saying. But one question that came up that I wanted to ask actually, and this is something that Linda said at some point, where Linda mentioned that, they're all women of color here leading these organizations. And the question is, what do leaders of color need? What do movement and grassroots leaders of color like you need right now, right? Because you too are affected individually and personally as you lead. So what is it, if you could name 1 to 2 pieces that you're thinking about in terms of what it is that you need to sustain your leadership, to sustain your momentum and your commitment, that I think would be really helpful to hear. So I'm going to start with Linda, because you actually brought us into that space of reminding us that we're all women of color in this conversation and bringing that solidarity message. So Linda, then Claudia, then Judith, and Arti. Linda, go ahead. You're good.
Linda needs to be trained in how to use technology. That's one of the things.
You're doing great.
So I would say that I'm going to speak on behalf of other women of color leaders, particularly African-American women leaders in Detroit, because I am a boomer. I've been on the scene for a long time, and I'd like to lift up the needs of those women. I would say that those women need to be brought to the table and given the opportunity to exercise voice and power in decisions that are being made for their community. That would be my one recommendation.
Thank you. Excellent. All right, Claudia?
I think that women of color, I echo Linda, by the way. I think you say it perfectly fine. But I think that women of color need more opportunities to build their leadership capacity and to be able to create their own network of support so that they count with peers that can lend them a hand when things become overwhelming. The opportunity to get more funding from foundations, from government, is in our shoulders, but our shoulders sometimes have a heavy, heavy burden of trying to be that link between policy work, everyday work in the trenches, leading our team, trying to do it all with very limited resources and time. And if we have more opportunities as women of color to have higher capacity, more time, more resources, more training, we would do wonders. We already do wonderful work.
Yes, already do.
but it would give us more tools in our toolbox to build a stronger movement. We need a stronger movement to deal with all these crises.
Thank you so much, Claudia. Judith, and then Arti.
Well, I believe that at a moment like this, we need to all rely on our spirituality and our values and our ancestral knowledge and practices. Rely on those things to develop the strategies for the short term and the long term. We have to rely on humankind's ability to respond and in ways that build community, but also that provide the resilience for generations to come. And lastly, it's a two-part answer. I think we all need to become Zoom-alicious, like totally Zoomified, know how to do it and do it well, because we're going to be doing this for a long time. It's going to take until the vaccines are made, and that's a long time.
You've given us a new word to aspire to. All right, Arti, what do women of color need and require in this moment to sustain leadership?
Many of us are caregivers. That's just our natural orientation. And if you're like me, you're sitting up at night thinking about all the things you could do better. You're taking care of your staff, your communities. And I think we need to give ourselves the space to know that we are human and that we really are here with integrity to do our work, and we're not, we shouldn't be criticizing ourselves and putting ourselves down. I think, one of the hardest things in social justice movements is people want us to be all things to all people. And we need to have the ability to just navigate that. And to have that inner strength to know that you are showing up as strong as you can. I think the other thing I'll say is we're going to be told when this is over that, there's nothing, don't be too bold. This is too hard. We're in an economic crisis. This is not the time. Just take what you can get. And I would just say, no way. This is the time, this is the moment to say, absolutely not. All the things we've had on our agenda, everybody's got one. We've had it for decades, whether it's broadband or immigration or clean water, clean air, those are the things we need even more. And so I would say the other thing we need to do is be absolutely bold, and don't let people say no to you. Yeah.
Thank you. And I think that actually segues very nicely into the last question that we had. And then I'll try to do a little bit of a synthesis, if I can, of the amazing knowledge and gems that you all have dropped. And so our last question, and we're going to bring that up in a minute after this slide, is what Arti kind of alluded to, a bold vision. And I was thinking about this, and I have been thinking about this a lot because I've recently read a piece, and many of you may have, by Arundhati Roy, who's a writer in India, and she wrote that the pandemic is a portal and a gateway between one world and the next. And so if you could imagine, and I ask even folks who are on the line, if you want to share your visions in the Q&A, please feel free. If you could imagine what a post-COVID society looks like, what does it look like? What is that bold vision? And what do we need to start doing now in order to usher in a more equitable future for Black, Indigenous, Latinx, and Asian communities? And so we're going to start with, actually I'm going to start with Judith, and then go to Claudia, Arti, and Linda. So Judith, if you could start.
So a post-COVID society, well, I think we have to realize that we are never going back to the way things were. This has been a total, permanent, political, economic, social, cultural interruption. So bridging that interruption and building forward, I agree with all of my sisters, we've got to be bold. And the one thing that I hope we can educate a broad cross-section of people who are being, the majority who are being affected by coronavirus is that Indian country is a very complicated relationship with all the other movements and governmental institutions, because treaty rights and tribal sovereignty is not only a legal category, but it is also a moral and inherent right. And we have a situation where the Trump administration proposed zero money for Indian tribes in this CARES Act, this last legislation, zero. And there was a pitched battle to get $8 million, where the estimates are 40 million is needed just to meet the urgent needs right now in Indian country to respond to this crisis. And the fact is that treaty rights and sovereignty is not just good for Indian people, it's good for democracy. Right. Because the truth is that we gave up land in exchange for healthcare from life to death, for housing and education, and the resources to build our nation. A healthy reservation, the Navajo Reservation, is the hardest hit. It's the size of West Virginia. It is having an extreme crisis there, but they've got to set up GoFundMe pages in order to respond to the COVID crisis. This is, I hope, in a post-COVID society, that people begin to understand how important it is that treaty rights are recognized, because it will mean that there's a strong political and economic democratic system. Because we're not going to achieve tribal sovereignty without deep, deep democracy.
Thank you, Judith. Thank you. And thanks for reminding us that we're not going to be able to go back. So I'm going to go to Claudia, and I should have told all of you 2 minutes only for this response. Claudia and Arti, and then Linda. Claudia, go ahead. What does the post-COVID society begin to look like?
Yeah, I agree that this is a tremendous opportunity to change the conversation, a conversation where we as leaders push a bold agenda to gain more power for people that have been disenfranchised for ages and ages in this country. We need to bring awareness to all the inequality that there is in this country, and the need to organize and mobilize so that eventually we have a post-COVID world that is more equitable, that is has more opportunities for people of color and for women. I really, really dream of a world where social norms that tolerate violence against women are over, and also social norms that allow the slavery of people that don't have resources is over as well. So I hope that the post-COVID is a different world, full of hope and full of resources.
Thank you, Claudia. Arti?
I would just add, I think I addressed this a little bit already, but that the systems that the intersectionality and the infrastructure that we're building now, because we have to, I'm hoping that post-COVID we can really enhance that, because we all need each other in order to achieve this vision, this bold vision we have of a new society. And no one community or group is going to be able to achieve this alone. And so I'm hoping that for our communities, this is also a moment where, you know, we are here for them, to engage them even further. As we're providing service, as we're giving cash cards, as whatever, this is a moment to engage them and have them also think about the long-term fight that we all need to do together. So, yeah, those are my hopes.
Thank you so much, Linda.
I would like to say that in the post-COVID society, I hope that we would be brave and courageous enough to really, as a society, begin to grapple with the historical legacy of slavery and the impact that that legacy has had and continues to have on the Black community here in the United States, and how it influences the current moment, how it shows up around our education, wealth gaps, health gaps. It's there, and it's rooted in these systems and structures that support a white supremacy nation that has not come to grips with the impact of slavery. to that end, I would offer up that we join in solidarity and support the HR 40 bill that was put forth by the late John Conyers, Congressman from Michigan, who wanted to bring forth in his revised bill an opportunity for us as a nation to both study and offer remedies around the impact of slavery on African Americans.
Thank you. Thank you so much, Linda. I don't think that I could summarize everything that you all said so eloquently, but there are concepts that keep coming up for me that I wanted to quickly share as we begin to close our conversation. And there's this big piece around how we can't go back, as Judith said, that it is time to expose, lay bare what I think we all knew, the structural racism caused by slavery, genocide, capitalism, settler colonialism, misogyny, homophobia, xenophobia, that these structures and institutions and policies are finally being laid bare, and that they have to be dismantled. And as Linda said, to be brave and courageous enough to address them, confront them, and dismantle them. And then build something new, right? Which you all have already been doing, as Claudia said, resources, communities where people feel safe, where people can actually exercise their full empowerment. And as Arti said, that government and policymakers have to stand with us, right? So whether that is long-term investments in terms of sustaining organizations on the front lines or sustaining women of color who are leading, as well as building an infrastructure that actually is coordinated and that works and is effective. So all of these are concepts that stay with me in terms of what you all said. And of course, it is all about building power. Building power and building solidarity across our communities and movements together. So I'm so grateful to all of you. And we didn't get a chance to talk about it, but there's also a global piece here that many of you are building, many of us are building across countries and borders as well, right? Recognizing that this is affecting everyone all around the world. And so that global solidarity is important to learn from and build together. So as we close, I just want to again really, really thank, and you all are mentors and people I look up to, colleagues, sisters. So I'm so grateful that you took the time to learn from you. Has been an honor. So thank you, Claudia Medina, Judith LeBlanc, Arti Kohli, and Linda Campbell for being part of Building Movement Projects and Solidarity is its first webinar, perhaps of many, that explore the effects of COVID-19 on vulnerable communities and how to build power. As we close, we're going to put up one final poll for those of you who are still with us to ask you if you would be interested in an extended series from us on the effects of COVID-19 on different communities around the country. We're hoping that you'll say yes, but we encourage you to get involved in whatever way that you can in your communities, in your organizations, and of course, please lean on us at buildingmovement.org or at solidarityis.org to connect with our resources, connect with the networks that we're part of, and all of us at Building Movement Project send each of you and the entire collective a hope for health, peace, equity, and power moving forward. Thank you for joining us, and we'll send out a recording afterwards with the resources as well. Thank you to all of you. Take care. Talk soon.